Good morning and welcome to Global Healthcast, brought to you by Global Healthcast. Today we have a special broadcast with Professor An Vo Le from Hanoi. He is an MD PhD working in the field of public health in Vietnam, and he's a professor at the University of Public Health in Hanoi. After graduating from Hanoi Medical University, he worked in research and as a lecturer on the epidemiology of dengue fever and hepatitis B viruses. He attended a master course on community health in developing countries at the London School of Hygiene and Tropical Medicine. In 1995, Professor An Vo Le was asked by the Minister of Health to move from HMU to establish the first school of public health in Hanoi and to become dean of his institution. In 2002, he built a practical network of public health based in provinces. Currently, Professor An Vo Le is chairman of the Vietnam Public Health Association, VPHA, I believe. Good morning, An. It's a great pleasure to have you here, and I hope VPHA is the correct term, right?
Good morning. How are you doing?
I'm fine, thank you very much.
Yeah.
So let's start with the first question. And today we have the special on COVID in Vietnam. What was the medical impact of the COVID pandemic in your country?
Yeah, medical impact. I like that. That's the focus, not health impact, right?
Yeah.
Yeah. Right after the government announced the pandemic, which was April the 2nd, 2020, quarantine was implemented to monitor people returning from epidemic areas. And then disinfection, hand washing, wearing masks apply for all people, especially those who was living around newly found cases. This for in most provinces, the incidence was very low in the first 12 to 20 months of the pandemic. That's up to provinces, but due to what I think the reason behind that was the herd immunity phenomenon. Hospital overloading did not occur during this time. Second point, in some large cities like Hanoi, Ho Chi Minh City, and tourist destination with high population density, such as Nha Trang and Da Nang or something, social isolation was more challenging as a testing kit and vaccine was not available, causing hospital overloaded. The incident rate increased rapidly together with death rate due to the lack of treatment facility, hospital bed, treatment regime, as respirators and medical staff. All of these problems combined to cause a panic, not only in the health system, but also the society as a whole. After 3 years of the pandemic, the government decided to change the classification of COVID-19 from Group A infection disease to Group B one. By that time, by the end of October 31st, 2023, Vietnam recorded more than 11.5 million cases of COVID-19 infection and more than 43,000 deaths. Yeah.
That is very interesting. Do you think the 11 million cases is the total, or I would assume there are many more cases that were not reported or not detected, probably not detected, right?
To be very honest with you, I agree with what you just said, that some cases has not been recorded, actually.
Yeah.
And no autopsy or nothing to certify that this was a cases. So the numbers are a bit, confused.
Yeah. You already mentioned the non-pharmaceutical interventions like quarantine, masking, hand washing. What were the problems with implementation of these measures in Vietnam?
As I have just described above, immediately after the epidemic was announced by the government, non-specific disease prevention like, including mask using, disinfection, no gathering, social distance, medical declaration, something was been applied. We call all that 5Ks, in Vietnamese word, we call that 5K. Instruction numbers of instruction has been issued on the level of social distancing according to the local situations. Yeah, that's what happening when we apply those kind of non-pharmacological intervention, something. Yeah.
Yeah. Did the government enforce this? Was there strict measures if you did not follow, or was it difficult to implement? Did people do what was requested, or did they try to not hand wash and to not wear a mask?
In any country, I don't think that whenever instruction has been issued and everyone, 100% of them will be applied something like that. It will be, increasing the proportion of those wearing masks, for example, and cleaning hands, for example, increasing later on, but not immediately. That actually caused a problem. Yeah, I don't know whether it caused a problem. Yeah.
You already mentioned this, but for how long did you have the restrictions? When did it start and when did you stop?
It's up to provinces. It's up to the situation at that time. It's not, we cannot talk anything for, similar apply for the whole country. But for example, in Hanoi, we have 4 different times, but continuously to apply that. For example, the first time, period of time, they start at 21st July to August 7, 2021. And immediately after that, from the 2nd August to the 23rd, 2021. And continue 4 times like that, continuously then. And I don't know why they mention, intermittent like this one, but continuously. 56 days continuously apply that kind of thing.
Yeah. So Vietnam has many provinces. How many provinces does your country have? Germany has 16 states.
63. 63. A little bit more than Germany. Yeah, 63.
Yeah, we have 16. So health in Germany is a matter of the states. So all the restrictions have to be implemented by the local states. And I understand the restrictions were implemented by provinces. Is that right? The provinces had to do it.
Actually, the state announced something. Since the state know exactly the situations of pandemic, so they know actually what will happen, what outbreak is more serious in which province. So they help, together with the information from provinces, will announce some limitation. Yeah.
Okay, very interesting. Yeah. And now the interesting question is, whenever you implement restrictions, there are side effects, there is impact, there is damage. What were the economical, social, political, psychological, and so on consequences of the restrictions in your country?
Economically, for example, as a lockdown is a compulsory apply, it means that all outside of the house activity which led to social gathering would be forbidden, something, and no economic activity available during that time. And you can imagine how bad it was at that time. Nothing will happen. And socially, like economy, for example, in education, the schooling has been stopped, but the online is okay. The online is still okay. But that, as a consequence, it caused a quality of training with huge problem, and more importantly, some depression has increased both in the school children, the parent, and the teacher also. There are, nearly 10,000 medical staff resigning or quitting their job in
Oh,
14.
really?
Yeah, for 14 months, January 2021 to June 2022. 16,000 teachers resigned in 2022. Mainly issues about remuneration policy,
Yeah.
attracting and appreciating talent mentioned in the state of the office later on,
Yeah.
Now, politically, the decreasing in economies and socio-economic instabilities might cause some risk of political disabilities,
Yeah.
and this situations last, if this situations last longer time.
Yeah.
Psychologically, as I mentioned about, depression among children, parents, and teachers increased. The burden would not only with COVID-19, but with other, including mental health, NCD data show that the mental disorder during COVID-19 pandemic increased significantly, such as incidence of depressive disorder. It's about 31, I just quote for the other study, 31%. Anxiety disorder, 32%, and sleep disorder, 41%. And every 1 in 4 person people have a mental health problems. That's a big problem later on.
Yeah. Very interesting, and I guess all countries have the same problem. So my question then is, when did first vaccination start? When did you have vaccine available in your country?
It's as far as I recorded here, I try to quote that the first vaccination start in March 2021 with 3 kind of vaccine. First of all, they use that for healthcare staff, those who are working in the front line. AstraZeneca, Moderna, Pfizer, by BioNTech. Yeah.
Very good.
We're very good that we have some program, some good strategy. We call that vaccine diplomacy, something. And the amount of vaccine gradually cover the entire population until near the end of March 2023. Yeah, the time that the government decided to change the degree of severe from A level to B level, something.
What were the vaccine recommendations? You already mentioned that healthcare staff were vaccinated first.
Priority, first of all, will be those who are fighting in the front line, and some priority people like the older people, those who have a lot of we call that basic, some kind of diseases. And those who has been recommended by WHO that those who are able, who are easily getting the disease, the COVID-19 from when it comes. Yeah. So such a people will be, and those who are working, still working. For example, like the police and the army, who have to go to the epidemic areas. That will be, and cover the whole later on.
Today, what do you think, how many Vietnamese people have received at least 1 dose of any COVID vaccine?
Yeah, that's gradually increasing, and at the end of that, so everyone.
Okay.
Everyone will receive at least one dose. But more than 85% of them are getting 2 doses and more.
Yeah. Here in Germany, we have a 2-digit percentage of people who refuse vaccination.
Okay.
And my question is, do you have that in Vietnam, or is this rare?
yes, there's a certain amount of that proportion. Those who are dislike to get the vaccine, even though they know that vaccine is rare, there's still. But I know the proportion of those. I don't know exactly what the proportion on the population.
Yeah. And my last question then is, what are the learnings from COVID-19 for future pandemics? You're a professor of public health, right?
Yeah.
You know the mechanics of how vaccines, vaccination, medicine, how that all works in your country. If you were to make a list of things to do better in the next pandemic, what would be on the list?
Yeah, actually, we have a number of things, of lesson learned. First of all, we must keep calm. I think that since a panic or something like that. So I think, first of all, we must keep calm, looking back to see what experience we have about epidemic of respiratory infection with cause like the virus cause like this one. And then the second one we should do is that we compare with what available and what was not. I mean, in terms of prepare for the pandemic. Then what need to be filled up by making use the time of herd immunity. As I said earlier, that period of time will last for 12. The silent time will last for 12 to 20 months up to provinces. So try to make use that time to fill in what need to fill, but we not yet we have not yet done that. We think that the government would need to consult with individual or organization who are responsible for this one, and and listen very careful their proposed, so that they may have review something good for the government to decide.
Yeah.
And the one that we found out is the fake news is a major problem and counter the pandemic. The pandemic. There's a lot of fake news, the pandemic. So that's why when you ask me if we're happy to do that, I immediately answer you, that's a big problem. Okay, remember? Fake news is a major problem and counter, and that causes all of panic or something like that. So we need to control the fake news. Otherwise, panic would cause a lot of things. Yeah. So one more is that every important decision made should be require some consultation. If not, they will lead to the quick but not accurate decision, and at least that can cause some waste of resources, if it cause. Otherwise, it might directly cause worsen the scenario with the death increase, for example.
Yeah.
This pandemic is a time of public health disaster, so we need to check whether the standard function set of public health has been well implemented. If not, what are the causes? That would provide us with direct lesson learned for better prepare for the next pandemic. Actually, we did a study on this one. Okay. In the long term, research laboratory focusing on epidemic agent produce vaccine, and test kit for detection will have to be prioritized for development in the near future. Public health research and intervention program will have to be conducted periodically to have a reliable data source in each locality in order to have a background data sources, which would definitely enable us to make much better responsiveness for the future disaster. Yeah, that's something that we think we discuss about that will be better for preparedness.
Yeah. What I like most is your first point, keep calm. I think this is important. The second is certainly to fight fake news. There was a lot of fake news everywhere in the world. And the third one is data generation, right? To have the right data and to have the resources to get right data, to get the correct data available. Yeah,
Yeah,
very
absolutely.
nice.
Yeah, yeah.
Would you have any last point that you would like to make on COVID-19 in Vietnam? Any important message that you would like to tell to people who watch us in our clip today?
Related to your questions about a certain proportion of population who refuse to get a more vaccine,
Yeah.
I suppose that potentially that might cause a problem later on. You know, since we don't know exactly what the proportion is, but potentially I think you're correct when mentioned such kind of thing. So if next the pandemic or next disaster will happen, and there's those proportion of people is increasing, and that cause a problem with you know, with the whole population, and that population health will be affected by those kind of thing. One thing, and the other thing is that in this country, the role, the function of public health has not been recognized clearly. And mainly they focus on technical, on medical, on medicine, you know. Even though I thought that it should be fair for thinking about exactly public health, what should they do, and we need them more. We need them strongly. Need them in order to strengthen the grassroots level of healthcare system, since those level has been nearest for the people, and immediately whenever people need to help, they immediately identify the problem and help the people. So strengthen capacity of those working in that level would be medicine, of course, medical doctor, but public health, and the approach of collective healthcare, but not individual healthcare, is a very important. You may know that the term of Ministry of Health here has been translated in Bộ Y tế. That means Ministry of Medicine, but not Health. You know.
Yeah.
When I see that the name of the other country, for example, in the state, they call that the Ministry of Health and Human Services. In UK, they call that Ministry of Health. In Germany, health also. But in Vietnam, we call that in Vietnam, in English they call that Ministry of Health. But translated into Vietnamese, they call that Bộ Y tế. That means translate in English, that's the Ministry of Medicine. And that's confused, you know, that's a very confused. So I talk with everyone. That's not right, and that will lead to something confusion. Yeah.
It is a misperception, right? The one perception is give me medicine and that will solve the problem. The real solution is public health. You do something, you vaccinate people, and then you can stop masks, you can stop everything, right? And so this is a very interesting point that you make. Ministry of Medicine is different from Ministry of Health. Very good.
Yeah. But what they did was that, you know, in Vietnamese they call that translate word by word in English. That is a Ministry of Medicine. You know, Bộ Y tế. Y tế, that means medicine. You know. But in English they call that Ministry of Health, Ministry of Health. So that confuses everyone.
Very good. This was a pleasure talking to you today. I had very interesting insights into COVID-19 in your country. I had a lot of learnings. I know now how things move on in your country and how you reacted and what the impact was. thank you very much for your time and for your questions. And I'm looking forward to seeing you again, maybe in the near future. Thank you very much.
Yeah, thank you so much. I'm looking forward to welcome you in Vietnam, as a